I'm here today at Children's Hospital with Joel Ender, volunteer sensei with the Kids Kicking Cancer program. Thanks for joining us.
Great to be here.
Would you be able to show us some of the techniques that you show the children here?
Oh, for sure. Love to. So what we're going to do here is our most basic technique, and this is something that's called power breathing. And power breathing is a way to get anyone, happens to be sick kids in this case, just to focus. And this is one of the things we do to just bring in focus, alleviate pain, lower anxiety. This is part of that self-control. So here's what we're going to do. We're going to stand with our legs shoulder width apart, and we're going to bend our knees so we're comfortable. Basic stuff. We're going to start with our hands sort of at our belly button, which is the center of our energy in the world of martial arts. And then what we're going to do is we're going to breathe in, and the best thing to do is breathe in through your nose, breathe out through your mouth. If you can't breathe in through your nose, breathe in through your mouth. But if you can, it's better. So we're going to breathe in through our nose up to our chest level. And then we're going to breathe in just a little bit more. And we're going to hold it for about 3 seconds. And then we're going to push it out. And a little bit more. And hold that for 3 seconds. Okay? That is basically the technique. Pretty simple. Now we add a few elements. So the first element is, this is about imagery. It's also about taking full advantage of what we're doing here, which I'll be able to explain a little bit more in a second. So as we breathe in, we want to physically, if we can, lift our bodies. It adds capacity. And then we're going to hold it. And as we breathe out, that last little bit, we want to actually lean forward a little bit in that last breath. Okay? So, in through the nose, out through the mouth, moving our body to the best extent that we can. All right, the next part is, as we breathe in, and this is something we deal with the kids especially, is we tell them that we want them to breathe in the light. And the light is different for every person. So it has no religious connotation. The light is a happy thought. It's a positive thing. For some kids, it's, they're thinking of healing energy. For some kids, they're thinking about their favorite hockey team. It's something positive to focus on as we breathe in that clean air. And then as we push out the darkness, we call it, the darkness is any stress, anxiety, pain, whatever. We want to get rid of the bad stuff. So we want to breathe in the good stuff, breathe out the bad stuff, okay? Especially with our young patients, we try to do this with eyes closed because it adds focus. It adds focus. We're in a very tumultuous sort of environment at the hospital, and there's always people walking by and buzzers going off and all kinds of stuff. So we want to be able to close out the rest of the world in order to make this the most effective, okay? And now our last piece that we add as we walk and talk kids through is we want them to just recognize at least that as they breathe in through their nose, that air is cooler. And as they breathe out through their mouth, that air is a little bit warmer, sort of used up air. Okay? Again, part of the imagery of it, part of the focus of it, and if you try this at home, and I know you will notice the air coming in your nose is cooler and the air you're blowing out is warmer. So, one last time, hands here, knees bent, and go up, breathing in the light, a little more, and hold it. 1, 2, 3, and we're going to push out the darkness, and that's power breathing.